We don't have the details of the MYSTIC trial results. We just know that it did not meet the primary endpoint of PFS. The study was complicated in the fact that any PDL expression was accepted, and so there were a number of different groups. The primary endpoint was the pooling of chemotherapy versus durvalumab and tremelimumab versus durvalumab. So when you look at different cutoffs for PDL1 and different treatments, there's a number of groups. And it's possible that some of those groups may have met the primary endpoint and some didn't, and we won't know that for some time. But for my overall response, I was hopeful that 2 immunotherapies would be better than 1. And that would not add that much toxicity, such as chemotherapy. So A, I'm disappointed, but B, before I make any major conclusions, I want to see the subset analyses. And also sometimes overall survival can be positive when PFS isn't, so we would want to see the other endpoints. But obviously, one could argue that the combinations of nivolumab and ipilimumab, where there's also many subsets and many different treatment groups, 6 major groups, it might make it less likely that trial will be positive as well. But I think it's too early to draw major conclusions.